Good evening and welcome back for another show with myself, Anthony Kashatorian. This time we've got something very, very interesting for you. We've got the wonderful Dr.Debkishore Gupta, who is an infectious diseases expert, and he will be dispelling a few rumors, providing a few fact checks, and also giving us a realistic picture of what is going on across India, across Bengal, in Kolkata, and hopefully we'll be able to zoom right into your homes and tell you about precautions you can take in your home, what to do if your family are sick. So we'll walk you through right from the wider picture, right down to the individual in your house. Dr. Debkishore Gupta, good evening. Thank you ever so much for your
Good
time
evening.
this evening. How
Good
are you?
evening,
Where are
Anthony.
you? Are you all set and well?
Yes, fine till now. And good evening, everyone. Yeah,
Good,
things
good.
are
Thank
fine
you.
till now. Yeah.
Good. So, Dr. Debkishore, just to make everybody aware of your background, what I've got here, you're a consultant and head at CK Birla Hospitals, previously with Fortis and Peerless, MBBS and MD from Burdwan Medical College, and then you were with the Burnett School of Medicine in Florida, and finally New York State Department of Health, where they trained you well in infectious diseases. So that's quite a global CV, Doctor.
Thank you.
Fantastic. Okay, so could you walk us through step by step what is the Indian picture right now, the Bengal situation, and then the Kolkata situation? Could you walk us through those three as you've been on the front lines?
Yeah, as you know, Anthony, I mean, the Indian picture is pretty clear. I mean, quite a few states are going really good job, and we are into the third phase, possibly entering the third phase of lockdown, right?
Right, right,
So, for few states, it's a little good picture, but for India, for our state, I think we have, I think, quite a number of red zones. So the problem with these red zones is that you have to again, continue with this lockdown for another 21 days. So that's the
right.
problem, and definitely you can enjoy a bit better lifestyle when you fall into this orange or green zone. But anyway, unfortunately, we are still in West Bengal and Kolkata. A lot of red zones are there, so we have to continue with the lockdown, or at least these containment strategies for these red zone areas.
Sure. Could you just explain in layman's terms what what is a red zone, orange zone, green zone, and how do you become a red zone or how do you become an orange zone? Could you just explain in layman's terms? Like for example, where we live here in Anandapur, we're in a red zone, right? In fact, Kolkata is a red zone. So what are the criteria for making an area a red zone, orange zone, green zone?
So basically, this is a containment strategy. So if you go into the containment strategies, you'll understand these as containment zones or clusters. So in layman's term, it just says that you have number of cases, then you become red zone, and you have something in between, then you become orange zone, and your some zone is totally free of any case for 21 days, then that's a green zone. So that's in a very flat language I can describe these three zones. So once you're targeted to achieve green zone, that means you have to free of any case for 21 days.
Okay, okay. And if you're in the red zone, you've got to take those extra precautions. Be careful where you're moving around.
Right. For red zones, all your containment measures are still on. You have to follow all the social distancing, and you have to stop your, restrictive movements, except these essential services. So basically, what we have been experiencing this lockdown for last quite a few days. So that's typically, valid for these red zone areas, red zones. And for the orange zones is somewhere in between. So but you can say this transition between this red zone and green zone, so where you can be a little watchful and you can hope for the best, and you can actually go into this green zone if you do not have much cases.
So, I mean, just a couple of hours before we started speaking to each other, recording this interview, the Ministry of Home Affairs has now extended the lockdown by another 2 weeks. Um, but it's still not very far away. It's just another 2 week extension if they open up. If there's an open up, is life coming back to normal? Can we go to the cinemas, restaurants, bazaars? Can we all go back to work, catch a train, go to
Yeah.
Delhi, jump on a flight, go to Goa? Is everything going to be normal? or do you
See,
think people
Anthony,
need
I
to
mean,
slow
there,
down? It's not
yeah.
ideal.
So, see, Anthony, there are actually two aspects to your question. First of all, there is a big if. So, as I told
Right,
in your previous question, that if you have to qualify for the green zone, then have to be case free for 21 days, right?
right.
So, it's still a far-fetched dream for us. So, honestly, I do not expect that very quickly we will jump into this green zone. So it's not going to be that easy. So coming to your
Hmm.
next question, that whether life is going to be same, so the answer is no. So we're going to have a kind of different normal, and definitely that's going to be I'm afraid that's going to be permanent, because if you look into this virus, the way it's behaving, it's affecting a lot of other countries. It's not a pandemic. So I'm pretty optimistic. Suppose we developed a vaccine, we generate a potent antiviral. Still, I think it's not going to be that easy for us. The virus may mutate. The virus may lose its virulence. We may develop herd immunities, but still, I mean, there has to be some kind of behavioral changes, some emotional changes, rather changes in the society, and that's going to stay. So because this coronavirus, novel coronavirus, is going to stay with us. It's not that just as I said, that it might lose its virulence. We may come across with uh, better antivirals and vaccines, but still it's going to stay. So we have to change ourselves. And if you look into this, how we should change ourselves, I would again say that certain things like hand hygiene and all those aspects, they were they have that those hand hygiene, everything, all this have been recommended since long. It's us, actually we forgot. We kept on keeping people, we kept on reminding people, we kept on reminding healthcare workers, wash your hand, this 5 moments of hand hygiene and these steps of hand hygiene, they become part and parcel of your quality indicators, because people just didn't want to follow that. Now with this threat of this coronavirus, so I think now is a big change. So it will help fight against other infectious diseases as well. So few of the behavioral changes are definitely for the betterment of our profession and the betterment of containing other infectious diseases as well. But this social distancing, these are certain changes that we have seen in our society. Perhaps this is going to last long, and people may not be that free as I mean, we used to mix so freely as few months back. So life is going to be different, and it's a different normal, I would say, even if everything
So,
be rosy.
you see social distancing, wearing of masks, hand
Yes,
hygiene,
yes.
no crowds in bazaars and malls and buses and trains. You're saying these are going to stay. They're going to be around a long time.
Yeah, yes. I mean, not exactly in the same way, but definitely there will be some kind of fear factor that's going to play, because I don't see, I mean, doctors going to rounds and not wearing masks. No, I mean, everybody is frightened now. I'm not very sure. I think these
Hmm.
are going to stay. And these malls and these bazaars, definitely they're going to open up. But there has to be some kind of restricted activities, because a good bulk of the population is going to be, apprehensive. So,
Sure. So, Doctor, let's make this practical and personal for our viewers.
yes.
Anthony and his family at home. Take for example, my family and I at home. What precautions can we take when we're at home? What precautions should I take when I'm going out to the bazaar, get food, come back in? Let's start with that. What can the average family at home do to stay safe?
So basically, when you are at home, then you are safe. So if you do not go out at all, I mean, none of your family members, then everybody is safe. So there is no doubt about
Okay,
it. Problem starts when someone goes out. Okay. So
right.
in that case, definitely now you have to follow this. CDC has mandated. I mean, maybe a month ago, that you have to wear mask. Even a cloth mask is sufficient. And now our government has also recommended the same. That, and you have to maintain social distancing, and definitely you have to avoid body contacts. You have to avoid crowds, and when you come back, it's I'm supposing that you are just going for a normal gathering, going to bazaar or some marketplaces. Then you just come back, you have, I think, I know that you have beautifully, re-established the concept of cleaning and disinfecting your footwears. So that's definitely is going to be a very, very effective, because you all know this virus stays even viable on surfaces. So definitely we have to take care of the footwears, the soles. We have to disinfect it for the bit safety of the society for other members. And then I mean, it's fine. I mean, just take a hand rub, you go come home, and better you change your clothes. You can, to be on the safest side, you can take a shower. That's fine. I think that should be enough, good enough. And
Fantastic. So,
here I just like to mention that often I see that people are wearing masks. People feel pretty confident and pretty comfortable, but at the same time they must also understand that wearing mask is also not always very, very safe, because you have to take care of hand hygiene before you wear your mask, and you should not touch the inner surface of the mask. You should not actually hang the mask over your chest. In that case, even if you come across with some with a crowd, you're actually contaminating the surface, outer surface of your shirt, okay, by the
right.
exposed part of your mask. So this certain small things you have to keep in mind, so that you do not self contaminate yourself. So these are also essential, in spite of you having taken these lot of protective gears, but still these small things which can still infect yourself.
And with regard to the mask and your hands, time and again, people are saying even ordinary soap is enough. You don't need to have antibacterial or
Right.
Lifebuoy or anything else. Is it the same with the mask? When I come home, can I wash it with any palm olive soap, or does it have to be Lifebuoy Dettol?
No, actually, I mean, for hand hygiene part, is soap and water is good, but for the mask, it actually depends on what kind of mask you're wearing. For cloth masks, fine, you can wash it, no problem. But I see people are wearing little sophisticated three-ply surgical mask or medical mask, and I see some people are wearing N95 as well. Although I do not me, it's actually not recommended for general public to wear N95 at all. But definitely, a lot of people wear this medical masks, which have a three-ply, three layers inside. So those are not meant for wash. Okay, you hang it. Better
Okay.
you hang it in the sunlight and keep it high, and then you can wear it. For three-ply mask is usually a disposable part. I mean, you should not reuse it. But again, I mean, for if you're not coming across with other hospital healthcare workers and not going to hospitals, then fine, you can still reuse it, or extended use, I would say. So these are allowed in pandemic situations, because you have to keep in mind that there is a huge scarcity in the market. So it's
Right.
better to
Right.
leave these, the high-end masks, respirators, N95 for the healthcare workers, and even a cloth mask is good enough. And yes, for cloth mask, you can definitely wash your cloth mask.
Fantastic. Um, Talking to people out there, we are all aware of the symptoms, symptomatics, and symptoms to look for. But a lot of people are now actually getting very, very afraid of this term asymptomatic.
Right.
So, what do you do as medical professionals? What do we do as ignorant civilians who are now beginning to worry that, hey, somebody who lives with me, somebody at my office, which now I may be able to go to, somebody sitting next to me on the bus, even with social distancing. People are beginning to worry about this trend about asymptomatic. How serious a threat are asymptomatic people?
See, the latest ICMR statement, they have said that it's close to 80% of Indian population are asymptomatic. So this data is a little scary. So the problem is, I mean, asymptomatic individuals are quite free, they're safe, but actually they are carrying the virus within themselves. So they become a threat to other people who are actually some kind of immunocompromised, and they can catch the infection from these asymptomatic carriers, and they may be infected. So definitely a threat, because unless and until you know who is symptomatic, you cannot put that person on isolation. So your entire strategy of quarantine, isolation, everything go for a toss, because you just do not identify who is having symptom. So that's a big challenge. Definitely, asymptomatic carrier is a global challenge, and not only that, I would say that atypical symptoms, patients presenting, or even other people presenting with some atypical symptoms, that's also almost equally important threat to us, because not many of the patients coming to us are having a florid classical symptoms of coronavirus, like they don't have flu fever, they don't have cough, but sometimes they are presenting with diarrhea, loose motion. They are presenting with other neurological problems. They are presenting with heart arrhythmia without having any fever or anything. So this becomes a big challenge, and this is also a equal challenge for dialysis patients, because the dialysis patients are it's they're inherently immunocompromised, and they hardly have any fever. So it's and they also have this fluid overload, so they have this problem of chronic cough. So they are also big mimickers of this coronavirus. So I would categorize this into three. Number one, definitely, as you said, asymptomatic carriers. This is a big threat. Number two is people having atypical symptoms, though actually those people do not know that they're actually suffering from coronavirus, and they again can transmit a disease. And if you're not having a very high index of suspicion, people are not going to test them primarily. And the third group is that, I mean, people are having minimal symptoms and actually carrying the virus within them. So they're also a big threat to themselves and also to other patients. And so
Okay.
not many people are having these classical symptoms. So it becomes quite easy, I mean, when patients present with classical symptoms, but may not be that easy for atypical or asymptomatic carriers.
So you're basically saying we're looking at around 80% of the Indian population being asymptomatic. So when we've got, you know, our guards at our complexes or apartment buildings with thermal scanners, and we're watching each other for fevers and coughs, you're saying actually all that could be all powerless. There'll be people walking in who show
Yeah.
no symptoms, who can defeat the thermal scanner, who
Right.
don't have a fever, no cough, and they'll walk into your house or to your
Yeah.
office.
Yes, definitely. So that's why you have to follow the containment strategies and your testing strategies. I mean, there is testing. There are testing strategies for asymptomatic carriers also. I mean, based on your prevalence rate. Suppose you're into low prevalence zone. I mean,
Hmm.
you can go for this pool testing, where you can have the entire cluster tested. So wherever mildly symptomatic, asymptomatic, they got picked up. Or if it's a high prevalence cluster, then you can go for these rapid tests. I mean, this antibody based testing. So this is a you can have to have this understanding where to use what. And there are definite strategies to find out these asymptomatic carriers, because this is a kind of essential element in our containment of the disease, because you just cannot ignore these asymptomatic carriers if you have to contain it.
Okay. Um, Before I come to the last segment where I'm going to ask you to do some myth busting, tell us the specifics of a mask. I mean, I see people, there's a handkerchief, but it's around their neck, or there's a three-ply mask, but it's up to their nose. I
Yeah.
mean, there is a protocol, right? From the way I understand it, from the bridge of your nose down to your throat, it should be there to there. You
Absolutely.
tell us where to wear and what kind of mask. Could you walk us through that, please?
Yeah, as I said, for the common people, I mean, even a cloth mask is enough. I mean, again, I'm quoting from CDC. If the
Right.
advisories change, definitely my statement will also change. As of now, we are dependent on CDC, and our Indian government has also replicated the same in our country. I mean, even a cloth mask is enough. You can, as a matter of fact, you can also use handkerchief, but again, you have to be very, very careful that you have to cover your nose. So often I see, I mean, as you rightly pointed out, people are wearing masks, but they are sneezing, pulling the mask out, and quite a few of them are having their noses out. So these are not actually acceptable. You have to cover the nose, and definitely it should not hang outside. It should not touch the other parts of your clothes. And you can also use 3-ply mask if it is available. 3-ply mask is pretty safe. It almost protects 95% against the virus. So this is all for general public, and for the healthcare workers. Even for the healthcare workers, I would say that 3-ply mask is good enough. Only for aerosol generating procedures, like somebody is intubating, putting into ventilators, doing laryngeal suction, patient is on BiPAP, patient is taking nebulization. These 5-6 conditions, somebody healthcare worker should use an N95 mask. So this is pretty clear. I mean, it's if you follow this WHO guideline, I think there is very little ambiguity, and I think that should be followed, because these are time tested, and even it holds true for other infections as well. So, and people have been using this, and it's pretty safe. I mean, we are also using this. We are doing this in our day-to-day practice when you come across patients, and it's actually pretty safe. I mean,
So for all the aunties and bhabis and didis who are wrapping themselves up in a dupatta, you're saying that's not going to do, right? Because it's coming into contact with the rest of their clothing and their
right,
body.
right, right, right. Yeah, yeah, yes.
So
It
not
should
a
be
safe thing to do.
should be kind of mask actually. So cloth mask. I mean, I'm not saying that you have to wear something very hi-fi, but even
Hmm.
handkerchief is still to some extent acceptable. But again, I would say that, I mean, you're going to the crowd and you're wearing your handkerchief, then you're coming back, you're putting your handkerchief in your pocket, so again you're rubbing your mouth. So these things we have to take into account. But again, something this is something very minimal, I would say. You have you can have some cloth mask. This is one step better, and 3-ply mask is definitely better, but that may not be very easily
Availability.
available to the general public. And I think cloth mask, I would suggest cloth mask for general use. That's pretty safe and pretty I mean, comfortable for the general public to wear also for a prolonged time. Because I often see that, I mean, people tend to wear a very sophisticated mask, but they actually become breathless after some time, and
Yeah.
they just pull down and take breath. So the problem starts
Defeats the
there.
purpose of wearing the mask.
Yeah, and problem starts there actually.
Yeah.
So you have to wear it for extended time. So for that, something comfortable cloth mask, is good enough for general use.
Sure. Some quick fire myth busting, doctor, please.
Please.
Indians are more immune than Europeans because we eat a lot of spices, we have a lot of hot drinks, teas, coffees, or whatnot. Indian immunity is higher than these Europeans. True or false?
It's difficult to answer it to your question. Hello, in
Yeah,
a just
sorry.
one sentence. I mean, it's difficult, but we are exposed to different kinds of viruses, different kinds of tropical illnesses. So our immunity may be a little better than the Western population, and maybe the virus strains are different for this coronavirus. So that's why it's behaving in a little better way in our countries. But again, I would say it's too early to say that, because still we haven't analyzed it further. We do not know the complete genomic sequence of this, and how it's yet to be identified how the entire Indian population, because this is only available when we test a good number of the sufficient amount of the sample sizes actually better. So then only we can can come to a conclusion that how our population behaved against this virus. But by and large, I would say that possibly, our immunity is little better, because we are exposed to so many different types of influenza viruses and coronaviruses as well. Because not only this is a novel coronavirus, but we have certain other coronaviruses which are pretty rampant in your community, like coronavirus 229E, HK, and other strains of coronavirus. So we often see patients having this, even succumbing to this. So we have some kind of immunity towards that, and that might help. And there are certain other myths. Again, I'll add one myth to your mythbusters, that there are people. I mean, people are working whether this malaria treatment, because in tropical countries we get a lot of we take a lot of chloroquine sort of drugs. So whether this is also helping against this coronavirus, that's a matter of debate. Only time will tell. I mean, there are a lot of controversies against this chloroquine and hydroxychloroquine. So I'm not
Right,
denying that,
right.
but this
Sure.
may so happen to affect Americans and Indians are behaving in a little better way against this coronavirus.
Sure. Another myth. Smokers are safe. We have tobacco in our blood. There was a study to say we are resistant to coronavirus.
No, no, no. We cannot say like that. See, the problem with this, you'll see a lot of studies and a lot of contradictory studies these days. The problem is in this pandemic situation, you can publish almost everything. Okay,
Yeah.
there is hardly any peer review, so you have to screen what you're going to believe, right? So you'll see a lot of contradictory studies. So just I think this is we just cannot come to some conclusion that smokers are safe, and the other day will say that smokers are at more risk. So
Yeah.
no, I mean, let's stick to the general perception that smoking definitely harms, and till it's contradicted by some very robust study published in a peer-reviewed journal. So at least I'm not the one to believe into these myths.
Sure. Um, Drink 1 glass of hot water with lime in it. That will keep coronavirus away. True or false?
No, if you look into this initial
Doctor,
WHO
you're going to break a lot of people's hearts.
now if you look into this initial WHO advisories, they have strongly recommended they have recommended that do not use vitamin C. I don't
Hmm.
know. I mean, even I'm not very sure why they wrote that specifically for coronavirus, novel coronavirus, but that was written. I mean, whereas we all know that vitamin C is an antioxidant, it protects against coronavirus, but it was written. It was an official statement WHO in the initial days. But as we learned, as our experiences, got accumulated from different sources, we came to know that vitamin C possibly helps. So now you will see in different government protocols that you will give high dose vitamin C. But honestly, I mean, there is not much robust evidence that every day you drink 1 cup of hot water and you have one lemon. So that may have some good effect, definitely. I'm not denying that. But whether this is effective against this coronavirus, I'm not very sure. So definitely, I mean, vitamin C, if you take vitamin C, this antioxidant, this might help you against other illnesses, build up uh, I, overall this might benefit you, but whether it specifically benefits against coronavirus, I do not know. And we have to depend on guidelines. And if you look into this therapeutic protocols of coronavirus, you'll see this is a high dose vitamin C. Okay,
Hmm.
so
More
well,
than you will get from a
yes,
lime or an orange or
yes,
something, right?
but again, I will not disagree that lime and lime has some antioxidant effects, so this might protect against other illnesses. So
And another grandmother's favorite, holud doodh. So that's warm milk with saffron, with a pinch of saffron powder. That will keep you
uh,
safe.
s- you see
Very good
this,
for your immunity. You will not get
yes,
coronavirus.
this is again these are all time tested antioxidants. So those benefits will definitely be there, but whether this will prevent against coronavirus, or if somebody is infected with coronavirus, this will reduce the severity. I think only time
We
will
just
tell.
don't know.
No, 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 we just do not
Okay,
know.
next one for you. Hot weather. India is a very hot country. We got nothing to worry about. It's not going to be as bad. True or false? Should we be comfortable because we have a hot climate?
Not we should not be that comfortable actually, but if you look into the science of transmission, you'll understand that this coronavirus or any matter of, or any virus, as a matter of fact, that they transmit. So the transmission is at its best, or it's at its peak at 8 to 9 degree Celsius the
Okay.
temperature, right? So when the temperature rises maybe around more than 30 degrees, so transmission may not be at its best level. Okay, so that's a kind of understanding you can have. But it's not helping. I mean, as
Right.
we have been seeing this coronavirus for last 1 month or so in this country. So honestly, we can see that this is not helping. This temperature is not helping much. This is still spreading, and maybe it's not getting transmitted as fast as we have seen in Italy or some other countries. But definitely, it's getting transmitted. But I do believe. I mean, temperature has some role. Definitely, these are this coronavirus, influenza, these are seasonal, infections. So environmental conditions should have some influence on this virus transmission.
Speaking of environmental influence, I recently had a big argument with a personal friend of mine. He was refusing to wear a mask. When I asked him why, he said, look, it's in the papers. The air is cleaner than ever. We're getting pure, clean air, no pollution. We should be breathing that in. It will boost our immunity better than a mask. So I'm not going to wear a mask. Is there any reason for us to not wear a mask, or do you think that's a bit silly?
No, no. I think somebody cannot just see these viruses, right? So how can I be so sure that you are not inhaling viruses? So anyway, I'm not saying that you just go and inhale viruses. Definitely, most of these infections like coronavirus are droplets. So you touch somewhere and then you self-inoculate that. But you have to trust. You have to have some belief on the international recommendations. So you just cannot go out and expose yourself to the general public. Suppose you are having infection and from you infection can be transmitted to other people.
Correct.
So
Correct.
definitely, please, I mean, my advice would be to wear mask.
And the last of the myth busting, I'm seeing a lot of rubbish coming up on Facebook and various other social media things. People are breathing in steam. They're getting steam. They're breathing in steam.
Steams, no signs in soaking yourself into the sun, no signs in, taking alcohols, drinking alcohols, so there is no science, absolutely no science behind that.
Brilliant. Dr. Debkishore Gupta, you've been a diamond. Thank you for all the information. You've really thrown some light on various aspects, and especially the myth busting. I think a lot of people will need to hear that. Dr. Gupta, thank you ever so much for your time, and have a good evening. Stay safe. Thank you,
Thank you
Dr.
so much.
Gupta.